Okay. Hey, everyone. Thank you. We're getting our crew in with the Mom Rising t-shirt. And come on, guys. You want to stand here? Michael, do you want to get everyone to... Okay. Okay. There we go. I think maybe I'll have someone on this side, too. Okay. Okay. Okay, very good. Well, I want to thank this incredible group gathered today. Especially I want to thank Senator Merkley for his work on the budget and being able to come join us here, given everything happening right now. I want to thank Senator Hassan, who is the lead Democrat on the Joint Economic Committee and has put out in record time reports on all of the impacts of this big, beautiful betrayal of a budget. Also, I want to thank Senator Duckworth for her incredible leadership in one of the biggest states in our country and being able to make the case, like many of us, that this bill isn't just hurting urban areas, something she and I have in common. We have urban areas, but we also have huge expanses of rural areas in states like Illinois, Minnesota, and actually Oregon and New Hampshire as well. So what's happening right now, I think you all know, the Republicans have rushed through this bill before their self-imposed deadline. They're claiming that they're going to do this. Why the rush? Well, we believe they don't really want to have people know what's in it, because people, when they find out what's in it, as you're about to hear from some incredible leaders of nonprofits and groups from across our country, when they find out what's in it in America, they hate this bill. I'll just quote a Fox News poll, because I love quoting Fox News polls, and also the president really didn't like this poll. I'll get you the quotes, what he said from Truth Social, in case you're not on it, from our great staff, Tommy, in a minute. But what this poll showed was that 60% of Americans are opposed to this bill, and it showed that 2 to 1 Americans think it will hurt their families. And 40% don't know what's in the bill. But for those that know what's in the bill, they really don't like it. Why? Well, it will close 300 rural hospitals right off the top. How? Because of the debt numbers with this bill, which is $3.4 trillion. It triggers Medicare cuts of $500 billion, which directly gut punch these rural hospitals, which are already just hanging on by a thin thread. In addition to that, you have the Medicaid cuts. What else does it do? It kicks 16 million people off of their health care. It raises costs for people, their health care, and it takes food assistance away from 4 million people. It threatens hundreds of thousands of jobs, all to pay for a $400,000 tax cut for the wealthiest. This isn't what Americans want. Republicans promised to lower costs. I know a lot of these voters because in my state, about 10% have voted for me and Donald Trump together. And these residents of our country, what do they want? They want to see lower costs. It's been the opposite. In that same Fox poll, I'm just quoting this one. There's a lot of good ones out there because it was the most recent, but it actually showed that people see that inflation and the problems of costs that they thought they were fighting to get down have gone the opposite way. That's because of the tariffs, and that's because of these assaults on the working people and on what matters to people in their country. We're talking about a mom in Louisiana whose son has Down syndrome and counts on Medicaid, or a bus driver in Kansas that we recently met at one of our spotlight hearings who uses SNAP to feed her kids. That's why Americans oppose this bill. It's hitting them. So we are working day to day, hour after hour, and we thank Senator Merkley and Senator Schumer for their leadership on this to push back and explain why these cuts and the way they have done this violate the rules in the Senate. When this comes to the floor, Democrats are united in taking on this bill in every way possible. We have several Republicans who've come out and said, hey, these Medicaid cuts, in the words of Josh Hawley, are immoral. We always like to quote Josh Hawley at Democratic press conferences, that they are immoral. Or we have heard that Senator Tillis was distributing pieces of paper showing how much It hurt North Carolinians when it comes to the Medicaid cuts. We also know other senators have raised issues. We have another group that is talking about the impact on the debt. They're right, it's bad. But the answer, of course, is to get rid of a bunch of these tax cuts for the wealthiest that are being put in place on the backs of working people. Then we have another group in the House that claimed they didn't really read the bill, and now they're having second thoughts. We call them the Oops Caucus. So that is what's happening right now, and we are so honored to have with us some incredible leaders from the nonprofit area who are working on this bill and are helping us. And that includes Claire Babineau-Fontenot, who is the CEO of Feeding America, who you're going to hear from, Kristen Rowe-Finkbeyer, who is the CEO and co-founder of Moms Rising. That's her cool T-shirt with the M on there. Susan Cressley, who's the president of the American Academy of Pediatrics, and Leslie Frayne, who is the executive vice president of SEIU. So these are different organizations. Some are political, some nonprofit, but are standing up and fighting these cuts and represent just 4 of what we see as thousands of groups that sometimes are coming from the Republican conservative side who are saying there's something that smells about this bill and it is wrong for America. So with that, I'll turn it over to Claire. Thanks.
Thank you, Senator. And I believe it's important to actually begin by making something clear. I'm actually here representing Republicans and Democrats and independents and every party affiliation in the United States, because I'm here representing the nearly 50 million people in this country who experience food insecurity, the nearly 14 million children who experience food insecurity. So I take that responsibility seriously. The Feeding America Network takes that responsibility seriously. And we engage with people experiencing hunger, and we ask them what do they need in order to thrive. And across all of those demographics, they share that bills like this one are not helpful. And in fact, they're quite hurtful in many ways. When we ask Republicans, how do they feel about the fact that at peril right now is taking away nutrition benefits for up to 2 million children? They find that concerning, as do Democrats and independents. This is something that we can all agree upon as a nation, that the richest country in the history of civilization should not have this many of its people struggling to make ends meet, finding it difficult to put food on the table. Another important point I think to make here is that Feeding America cares about people experiencing hunger, and therefore we not only care about the implications for SNAP, we care about all of the implications that will be talked about today, because the very same communities that will be hardest hit by these cuts in SNAP are the communities that will be hard hit by the other cuts as well, like Medicaid. So while we talk about the potential of closing rural hospitals, we should also think about the potential of closing rural stores, independent grocery stores that are the only thing that separates some rural communities from being food deserts, that are at risk right now, almost 30,000 of them at risk right now with this legislation of closing their doors. How might we even quantify the economic implications of such a thing when not only does that small business go out of business and then try to find another way to support themselves and their families, but also that community goes without food? Do we also quantify the transportation cost associated with getting to the closest store? There's a common sense solution. Let's take this legislation and let's put it in regular order. As it relates to nutrition programs, we actually have a beautiful device that can be used. It's called the Farm Bill. And through that Farm Bill, we can look at the ecosystem that exists, and we can think about all of the implications, and we can make certain that the most vulnerable among us are not caught in the wide net. So we encourage everyone to pay close attention, not only to the headlines, but to the fine print, and understand the significant implications for our country should the bills as currently suggested pass. Thank you very much.
Well, thanks everybody for being here, and Senator Klobuchar, thank you for organizing us all today. To our advocates, including Claire, thank you so much for being here and for the work you do to raise the voices of Americans from all walks of life, all political persuasions, and from every single corner of our country. Look, President Trump and congressional Republicans continue to push forward with their bill to give more tax breaks to billionaires and corporate special interests, paid for by adding trillions to the national debt, taking health coverage away from 43,000 Granite Staters and millions of Americans, triggering nearly $500 billion in cuts to Medicare, and raising premiums and other costs for everybody. And I just want to focus on that. This is not just about, as bad as it is, cutting people who need health care off of Medicaid or making it harder for people to pay for their Affordable Care Act premiums. When there are more uninsured people in our health care system, it drives the cost of premiums and health care for everybody up, just at a time when people are struggling to make ends meet. This Republican budget bill will result in cuts to Medicaid, Medicare, and the Affordable Care Act, all designed to make health care harder to get and more expensive for those recipients, as I just said, and for all Americans. Americans from all walks of life, including parents, doctors, and leaders of community organizations, are speaking out about the ways in which this bill will make life harder when people need relief from rising costs. So just recently, I met with Granite Staters, including in New Hampshire's rural North Country, and I heard about the devastating impacts that these healthcare cuts will have on both people who need healthcare and on the ability of providers to keep their doors open. This bill doesn't stop at healthcare cuts. It also takes away food assistance, as you have heard, from the people who need it most, and raises energy costs on families across the country. All of this just to pay for more tax breaks for billionaires and corporate special interests. Now, I serve as ranking member of the Joint Economic Committee, which recently issued a report finding that the president's reckless tariffs and this budget bill combined will result in the average teacher losing $490 a year, and at the same time, the wealthiest 0.1% of our population will get a windfall of $348,000. The bottom line here is clear. If congressional Republicans and Donald Trump get their way and pass this bill, more people will get sick, our economy will be weakened, and families will be hurt. Lastly, I just want to remind people that my colleagues and I have put forward a number of bipartisan proposals to lower health care costs. If my Republican colleagues are willing to abandon their dangerous partisan bill, we stand ready to work together to actually lower costs for people. To Claire's point, we have a system around here called regular order where we could get at this issue and make real progress. In the meantime, we're going to stand alongside our constituents who are speaking out about the harms that this bill will cause. And as somebody who has been working really hard on the issue of maternal health and maternal health deserts, an increasing issue in New Hampshire, especially rural New Hampshire, I want people to think, we've heard from the last speaker about the possibility of increasing numbers of food deserts, especially in rural America. This Medicaid bill will include and will create even more healthcare deserts, not just for moms, but for kids and people who really, really need care. So I hope that my Republican colleagues will take this to heart. I hope that they will see beyond the political rhetoric here and listen to the individual stories and experiences of their constituents and reverse course and get to work on actually lowering costs for people. And with that, I'm going to turn it over to Kristen Rowe Finkman. Thank you.
Thank you. Thank you to the senators who have brought us here today. Thank you for your leadership. Thank you for being here. I'm Kristen Rao Finkbeiner, Executive Director of Moms Rising. I'm here representing the 1.2 million active members of Moms Rising who are now 1 in every 300 people in the United States of America. And all the moms of America are saying shame on the Republican senators who are even considering voting for 16 million people to lose their health care, voting for millions more hungry children, voting for higher grocery costs and utility bills, voting for hospital closures, voting for public school funding cuts, and voting for even more human rights abuses unfairly put on immigrant families. Republicans are voting for decreased access to maternal health, decreased access to reproductive health care, and decreased access to elder care and child care. It's awful. Moms are watching. And all of these many, many devastating cuts are just to fund trillions of tax breaks for people who are already very wealthy. Shame on those Republican senators for considering voting on this bill. America's moms are horrified. The proposed cuts are not only shameful, they're also, as you've heard, highly unpopular across the political party. The Republican reconciliation is nothing short of a betrayal of the American families, of moms, of dads, of people of America, and it's a betrayal of our businesses and our economy too. That's why Moms Rising members have already taken over 970,000 actions in opposition to this bill. That's why they've already done over 2,800 hand deliveries in district of the Families Over Billionaires storybook that talks about how we will be impacted by these cuts to local congressional offices. We're lifting up the fact that Medicaid is critical. 40% of childbirth happens with Medicaid. Over 60% of nursing home stays happen with Medicaid. 1 in 3 people with significant disabilities are able to live their lives because of Medicaid. Cuts in these areas are shameful. We've also heard over 50,000 stories submitted from our members about how these cuts would impact them. And as soon as I leave here today, I'll be meeting Moms Rising volunteers in the Hart Senate office building to tell Republican senators what's on the line for us. We'll be delivering stories in this book to every Republican Senate office today with moms, with dads, with kids, with people, and with kids dressed up in bee costumes. Yes, bee costumes. It is a humorous, impossible to ignore, breakthrough way to make sure that we cannot be overlooked like we're being overlooked with these cuts. We're here to speak out for and to save the programs that matter most to moms and families. And guess what? Economist after economist are saying that these programs are also essential to our actual national economy, to our businesses, and to all of us, too. We're here for Medicaid, for SNAP, for public schools, for reproductive health, for affordable child and elder care, and for the fair treatment of immigrant families. We're here to help these senators who are in this room and the Democratic senators who are standing up for us save our country, save our families, save our economy, and save our democracy. And we're here to urge every single Republican senator to join them in voting no on this disastrous betrayal of a bill. Thank you. Oh, sorry.
Thank you, Kristen. Well, hi, everyone. Thanks for being here. Thank you, Senator Klobuchar, Hassan, and Merkley for bringing us all together today. You know, when I was in high school, my family struggled. In fact, my father had been unemployed for 5 years. The only job he could find was below minimum wage, with tips making up the difference. My mother took in sewing, and even as a high school student, I had an after-school job. We had no money, and some days, no food. We were teetering on the brink of homelessness because all of our money combined with those 3 jobs barely paid the rent and a little bit left over for food, but we never were sure what tomorrow would bring. And at the end of the month, we usually ran out of money. I still remember going to the grocery store and counting out our last 5 $1 food stamps back when they were pieces of paper, trying to buy as much bread and bologna as possible, hoping that it would be enough to last us through the end of the week when the next batch of food stamps would arrive. Let me tell you that I was only able to be elected senator I was only able to become an Army helicopter pilot because I was able to stay in high school. Had those food stamps not been there, I would have dropped out of high school and taken a second job in order to feed my family. So let me tell you, on behalf of families like mine, on behalf of the 200,000 citizen soldiers in the United States Reserves, Forces, that's Reserve and National Guard, who rely on food stamps, even though they're still serving, I beg my Republican colleagues, please don't do this. I'm only here this morning because of programs like SNAP. For millions of Americans, that basic sense of care, that basic sense of dignity is about to be stripped away. That basic sense of safety is about to be ripped from under their feet. And what is at stake? That's what's at stake if bills like the ones that my colleagues are talking about passes our chamber. That is what is at risk if Donald Trump and Senate Republicans get away with enacting legislation whose goal seems to be cruelty simply for cruelty's sake in order to fund the richest among us. They're snatching away health care and SNAP benefits from countless families. Those hospitals that will shut down should these Medicaid cuts go through, not only will we be lacking the health care in rural communities, but also oftentimes the largest employer in a tri- or quad county area. From veterans who serve 5, 6, or 7 tours, they will also have their benefit ripped away. They're looking to rip away benefits from kids who just want to go to bed without their stomachs growling. From moms who are working double shifts, who wake up every morning terrified that, thanks to the GOP's Medicaid cuts, they won't have enough money to cover both their insulin and their rent. I am pissed off, and I hope that everyone here is as well. My Republican colleagues should be ashamed, and I am certainly ashamed of them. And I urge every one of my colleagues on the other side of the aisle who claim to care about veterans or families when they're on the campaign trail to actually spend a half a second proving it when the rubber hits the road. And to join me in voting hell no against this abomination that they're trying to call legislation. I'm out of time, so let me just close by making sure to thank everyone here for being my partner in this fight. Having each and every one of you on the front lines means so much to so many, myself, but also all of those Americans out there who did not vote for the "we're all going to die anyway, let's put our kids to bed hungry, let's cut education" policy. With that, I'm going to turn it over to Dr. Susan Cressley, President of the American Academy of Pediatrics. Thanks for being here.
Okay, Dr. Cressley, thanks, that was incredible. Thanks so much for the opportunity to be here and for the senators for their warm welcome and opportunity. I represent 67,000 pediatricians across the country who are going to bed and not sleeping because we are worried about the children that we are privileged to serve in every community across the country. We wake up every morning trying to figure out how we can support children. Let's be perfectly clear. This bill, it will cause devastating impacts to children. And while children only represent 22% of our population, they represent 100% of the future, and they will bear the brunt of most of the legislation in this bill. They will lose food through SNAP, and importantly, the entire pediatric healthcare delivery infrastructure is threatened with the cuts to Medicaid. And let me connect the dots for everyone in the audience. When we think about Medicaid, 50% of children in this country, yes, half of our children in every community, and it's more than half in some states, depend on Medicaid as their health care insurance. This is health care insurance and coverage for half of the nation's children. But in addition to those children on Medicaid, every pediatric care delivery system in rural communities and in children's hospitals in urban centers depends on Medicaid funding in order to keep their service lines and their service offerings for children open. So what will happen with cuts to Medicaid? Children's hospitals, rural health centers, small, medium, and large pediatric offices across the country will lose their funding because they have lost the Medicaid payments, and they will have to make hard decisions. Are we closing our doors? Are we creating child health care deserts in our communities, both urban, suburban, and rural? Are we cutting program lines in children's hospitals that do research to cure pediatric cancer or to deal with devastating injury protection and advances in medicine? There will be cuts to child health care services, and it doesn't matter what your child's insurance says on the insurance card. If you show up in an emergency room or a pediatric care delivery center or a rural hospital needing care in your utmost need, moment of need, if those services have been cut, it will not matter what kind of insurance you have. Your child will not get the care that they need in a timely way from the pediatric experts who are dedicated to serving them. So as we work together, we understand that children are not of any political persuasion or party. They don't get to choose where they live. They don't get to drive themselves to an emergency room or a doctor's office in the middle of the night. They depend on adults in the room to make smart decisions to keep them safe and healthy. And every community in every state depends on the children of the future being healthy so they can contribute to the economy and make us stronger as a healthier community. And if we don't get behind and do what we need to do to support the children, the future of all of our communities will pay the price on the backs of our children. Thank you.
Families lose, billionaires win. We've heard the story about healthcare. We've heard the story about child nutrition. We've heard about how rural clinics and hospitals will shut down, affecting not just those on Medicaid, but those who have insurance through any direction if that clinic or that hospital disappears. Families lose, billionaires win is a terrible mission for America. It's a terrible bill that's a terrible future as well. Because in addition to devastating health care for billionaires to get richer and devastating nutrition for billionaires to get richer, it also creates massive debt on the next generation. $3.4 trillion over 10 years. More than 30 trillion of additional debt as compared to current law over 30 years. Our Republican colleagues have become the most fiscally irresponsible group to ever inhabit this Capitol. They are breaking the fundamental rules of reconciliation. The first rule in the past was there could be no deficits over a 10-year period. They broke that. The rule still exists, no deficits beyond 10 years, and yet they're using a magic basis to pretend there is not debt into the future when there is. So they're breaking a third rule, honesty about numbers. So we have heard today from these incredible advocates of the immediate impact. But let's realize that families are going to be hurt far into the future. Those children who are 100% of the future are being so impacted by the devastation of programs on health care, housing, education for a generation to come. This bill is wrong in every possible way. It is, in fact, a big, beautiful betrayal. President Trump ran on helping families. But at that inaugural address, you saw who was standing behind him. It wasn't these advocates fighting for a better life for ordinary Americans. It was a set of billionaires. And this bill is all about billionaires too. So we're united in calling on our Senate Republicans to honor the mission that we should be fighting for. Not the mission of families lose and billionaires win, but families should thrive and billionaires should pay their fair share. I'm delighted to turn this over to Leslie Frayne, Executive Vice President of SEIU.
So I appreciate the opportunity to be here to speak on behalf of the 2 million members of the Service Employees International Union, including over 1 million healthcare workers. The fight to protect Medicaid is deeply personal to our members because this bill, it's not a budget, it's a full-on assault on working people. The House bill, frankly, was ruthless and it was inhumane. But the Senate bill is even more devastating. It contains cruel and unprecedented cuts to Medicaid and also the Affordable Care Act that will leave millions without the care that they need and that they deserve. Medicaid has been in Republicans' crosshairs since day one, and we should be clear about why. Yes, it's because the Republicans were committed to finding money to pay for the tax cuts that they so desperately wanted to give to their wealthy cronies. But it's also because the people who rely on Medicaid for care are people that Republican leaders are willing to throw under the bus. At its core, this bill represents the largest transfer of wealth from working people to the very affluent in our nation's history. It will cut more than $1.3 trillion from healthcare, and according to the CBO, it will rip healthcare away from 16 million people. None of this is what Americans want. Medicaid and healthcare cuts. Medicaid is deeply popular, and healthcare cuts are deeply unpopular. A majority of voters, and this includes Republican voters, oppose these cuts. And it's no great mystery why. 80 million people count on Medicaid for their health care, including 37 million kids. Medicaid pays for home care that allows seniors and people with disabilities to live with dignity in their own home. Medicaid funds nursing homes and services for people with mental health needs or developmental disabilities. And when it comes to work requirements, the vast majority of adults on Medicaid already work. Adding onerous paper requirements, it's just a cruel excuse to take life-saving care away from the people who need it most. I want to say a few words about what these cuts would mean for hospitals. If Congress cuts hospital provider taxes, many rural and urban safety net hospitals would shut down completely. That would leave entire communities without emergency care. And when somebody's having a heart attack or is in a car accident, every second counts. For healthcare workers, cuts to Medicaid directly impact their livelihood, whether it's because a facility could close, because providers could slash pay, or because beneficiaries lose their eligibility. And the reality is that cutting Medicaid drives up medical costs for everyone. Because when people lose coverage, they still get sick. And they end up in emergency rooms where care costs even more. Hospitals end up eating those costs, and they pass them on to the rest of us through higher premiums and higher bills. States get hit too, because with less federal funding, states face dismal choices. They either have to raise taxes, cut other vital programs, or slash healthcare even further. In the end, these cuts don't save money. They just shift the burden onto working families, onto overworked hospitals, and onto struggling communities. And let's be honest about what that really means. People will suffer. People will get sicker. And yes, people will die. That's why SEIU members are standing up, speaking out, and fighting back. Just this week, 600 of our members have traveled to DC, from Alaska to Florida, from Boston to Los Angeles. We've been in the halls of Congress, outside Senate office buildings, and at events on the Capitol lawn. And when this vote is done, we will seek accountability for any elected officials who votes to deny working people health care, because health care should be a basic human right.
Okay. Incredible group here. Questions? Oh, you okay? Oh, my goodness.
Turn the cameras off, please. Cameras off, please.
Thank you. Right? You got it? You sure you're okay? No, don't worry about it. Yeah. Do you want to just bring a chair for her? That would be great. Okay. Okay. Thanks, Tammy. Thanks, Leslie. No, and we're ready to, because we are resilient, we're ready to take questions. Okay? Anything? Yep.
So, yes, there's absolutely been opposing opinions within the Republican Party over the Medicaid provisions. However, some other Senate Republicans also argue that the reforms aren't necessarily cuts because Medicaid spending is still projected to increase when they count the votes. What is your reaction?
Okay, so I'll let some of my colleagues chime in. But this is very clear when you really step back and look in this, and there's been analysis after analysis of this book of this bill, including by the CBO. What this does is it cuts benefits, yes, health care, food stamps, you name it, for the people who are working really hard and can hardly afford it. Where do the benefits go? Time and time again, it shows, every analysis you look at, that a bunch of this goes to the wealthiest people. You look at any mainstream analysis of this bill, that's what happens. And the one thing that I think we have not emphasized enough is this debt piece of it, and the $3.4 trillion in debt that is produced by this bill. What does that mean? Well, $1 trillion of it is interest, $500 billion based on interest right now, $500 billion additional based on the fact that it adds so much debt. And when you do something like that, the wealthiest people, it's not going to affect them. But the roadkill is going to be everyone else, and especially people that rely on programs like Medicaid. So instead of working on healthcare reform, which the president could do in a real way to help people, instead of giving all this money to the richest, and by the way, if you want to do something to work on the debt, they could literally shave off the tax cuts for the wealthiest. They could do things like increase the corporate tax rate by just 4 points. Every point you do is $150 billion, almost gets you to $1 trillion right there. But even if they didn't do that and they just got rid of the tax cuts for people making over $400,000, you would save $2 trillion that you could plow into housing or put into a debt reduction fund. That's what they're doing. So when they start talking about the debt, and those Republicans that are concerned about this bill because of that, they're right. But it isn't because of the people that Leslie represents. It's because of all these tax cuts going to the wealthiest. And I don't know if people want to add, Maggie.
I just want to add a couple things. First of all, the Nonpartisan Congressional Budget Office says this bill will kick 16 million people off of health insurance, either Medicaid or the Affordable Care Act health insurance. Their overall healthcare costs keep going up, and there is incredibly important work to do to lower the overall healthcare. But as you heard from the doctor here, what this bill does is you take away key funding for children's health care as we continue to see labor and delivery centers close, as there's an increasing number, if this bill passes, of healthcare deserts generally. You are shrinking the supply of healthcare. The demand for healthcare does not go away. So yeah, healthcare costs will keep going up. Instead of doing the work, the bipartisan work, and there's a slew of bipartisan bills that actually attack the overall cost of healthcare, focusing on prevention and primary care, taking away hospital facility fees, doing more to reduce prescription drug costs. All those things are things we should be doing. But instead, they are these so-called technical changes, which is the euphemism that my colleagues on the other side of the aisle are using, are designed to be barriers to keep people who are eligible for these programs from getting the care. And that's how they are saving money, by 16 million people losing their health care. These are all barriers to access from people who already are eligible and may continue to be eligible, but just won't be able to jump through all the hoops in enough time to make sure that when their kid gets sick, they can get to the hospital and get the treatment their child needs without going bankrupt, or without the hospital having to bear the cost, or without the rest of insured Americans seeing their premiums go up to bear the cost. Thank you.
Frank? Okay, Jeff?
Absolutely. I'm glad you raised that. We will be putting forward a series of amendments to highlight how we could actually enable families to thrive and billionaires to pay their fair share. So think of those categories as ones that we'll definitely have amendments on. We hope Republicans will join us in that better vision. Families thrive and billionaires pay their fair share is a much better vision than families lose and billionaires win.
I'm going to give this microphone to Tammy. Talk a little
Yeah, thank you. So again, with the Votorama, we're going to do everything we can to force Republicans to face their constituencies with very important votes that will restore SNAP benefits, that will restore the Medicaid, and oppose the attempts that they're making to make Medicaid more difficult for people to access. Remember that they also have gutted federal bureaucracies so that even if you did the paperwork in time, you may not get your paperwork processed in time. And so we're just going to hold them accountable. And I certainly am going to raise the awareness of all of the troops and military men and women who rely on SNAP benefits. It's something I've been working on for a very long time. In fact, as was already mentioned, this should be in the Farm Bill, the SNAP program, and it's going to hurt farmers as well. So we're going to also focus on what the cuts to SNAP will do to America's agriculture.
I'm going to just turn this over for Leslie, because one of the reasons we're all here together is while we're in the middle of that Votorama, a lot of the action is people at home and people who are affected by this. So that's going to be a lot of what we're doing, is having regular people tell their stories while we're in there duking it out with these guys, because the votes that we're going to want to put forward is really gets at some of their own complaints. They say it's immoral to make the Medicaid cuts. Well, then let's vote on that. You have your opportunity to vote on whether or not it's immoral or not. You say you shouldn't leave people in rural areas without rural hospitals, vote on it. Shouldn't leave people in rural areas without food assistance, then vote on it. So we literally could use some of the same words that they've been using out there and make them take a vote, make them be accountable. And if we get them on our side on this, great, then we change the bill. But I want everyone to remember that besides what's going on there at 3 in the morning or whatever time, what really matters is what the people with us are doing. So, Leslie.
So thank you so much, Senator Klobuchar. We are so grateful for the leadership of Senate Democrats who are, through Votorama, sponsoring amendments that will highlight the hypocrisy of Republicans who claim to stand up for working people and yet vote in favor of bills that would devastate our families and our communities. But as Senator Klobuchar says, there is also a responsibility for a growing resistance movement to tell the stories in the field, and that's why organizations like my own, SEIU, like the other organizations that are represented here, and many, many partner organizations out in states all across the country have been working hard and will continue to work hard to hold rallies and protests and pickets and vigils and to conduct acts of civil disobedience, to do marches, to send letters, to send texts, to do social media, to pay for digital ads and in some cases broadcast ads. All of the actions that we know mounts pressure on Republicans to actually do what's right for their constituents and for all Americans.
Okay, yep. Come on, Jeff. That sounds like a fun question.
Oh, we have not. We are raising the issue in every way we can. I'm raising it on the floor of the Senate. We're raising it in press conferences. We're raising it with the parliamentarian. You saw what Republicans did on the Congressional Review Act, where they had a very complicated series of votes trying to bypass the parliamentarian. We want the parliamentarian to rule on this. The section that they're using to create this fake baseline to lie to ourselves and lie to the American people about what this bill costs has never been used in reconciliation. It's never been used on a broad basis, never been used on a partisan basis. It was the ability to solve some technical difficulties in a bipartisan way on regular order bills, not reconciliation. So I'm hoping that we can get the parliamentarians to weigh in, and that we can get our Republican friends who are destroying the last remnants of a construct designed to create some opportunity of fiscal responsibility to say no. They're not going to be advocates for massive deficits and massive debt, all to fund tax breaks for billionaires. If I can sum up this bill, it's the red carpet for billionaires and it's red tape for ordinary Americans.
Okay, one last. Yeah. I'm just so happy because all 4 senators stayed till the end, just to show you how intense we are about this.
As the call of committees is happening.
Yeah.
So, yes. Okay.
We're fast.
Senator Klobuchar, this question is for you.
Oh.
Polling suggests that a majority of Americans do actually support
Yeah.
polling by Fox News, 75% of independents, 70% of Democrats, and maybe 89% of Republicans. So talk to me about what you do support.
Of course. So over the years, we've actually added reforms to the SNAP program. I know I've been on the Agriculture Committee for a number of years. This is under Democratic and Republican presidents. We've added work requirements. I understand the support for that, and I support work requirements. What we're doing here, however, what they are doing here is they're actually going into people who have young kids. And the original House proposal actually had changed the numbers of how old the kids could be, where the parents would have to work, to 7. If I could go to, it was 7. They went down to 7 years old. And the Senate Republicans, Senator Bozeman, actually thought that's a really difficult thing to say. You have a 7-year-old, and we're going to make sure. So they changed it to 10. So it's not just me saying this, that there are problems with these work requirements as they added them. Not at all. I'm in favor of work requirements, let me tell you. But some of these things that were made on either end of the spectrum, even Senate Republicans changed them. So I think that's my best evidence to say that some of them went too far. That being said, on the SNAP front, I thought that Claire's points were really well taken. The bulk of those cuts coming out of the House had nothing to do with work requirements. The bulk of the cuts, $155 billion of the cuts coming out of the House, were on this faux shift to the states. So you had red state governors, blue state governors saying, wait a minute, say Pennsylvania, the House bill shifts over $1 billion to their state budget. $1 billion. They have 41 of the states have balanced budget amendments, right? So just in the middle of the thing, you're going to go, oh, you have North Carolina 5, you have $500 million, you've got this much for this state. They couldn't do it. So there was clearly a pushback. That's why, again, Senator Bozeman made some changes, which got it down to about $200 billion in cuts from $300. Then the parliamentarian looked at it and said, this doesn't work this way under our rules, cut another $43 billion. So there are severe problems with the SNAP program. And Claire's argument, which I have found and we have all found in our rural states, it is not just about the hunger argument, which is huge, but it also in many of these counties or regions, they have one grocery store, barely get by. My grocery stores have had me, I've gone 11 grocery stores now in terms of making this case on SNAP in rural areas, and our farmers. So the farmers already taking it back because of the Trump tariffs, because of the cuts at USAID when they produce the food, because of input costs, because of the fact that we haven't had a farm bill. All of these things are affecting the farmers, and then this is the final thing. So I think people might be surprised when you see the numbers on some of these polls of why people hate this bill, but 1 out of 13 Americans get some kind of food assistance, and so many of them are working 1, 2, or 3 jobs. And my final point that I promised I'd make on the Fox News poll was Trump's reaction to the Fox News poll on Truth Social. It's why MAGA hates Fox News, even though their anchors are great. I love that. I thought that was funny with Capo Great and crooked Fox News poll. Clearly, it wasn't crooked because it's consistent with every single poll right now in America.
Thank you, Senator Klobuchar. Before I go to committee, I want to make this point on Medicaid and work requirements. We all want people to work. Most people, most adults on Medicaid are working, and I want people to understand that. We passed Medicaid expansion in New Hampshire while I was governor on a bipartisan basis. One of the major reasons we did it is the people who came to us who said, got laid off from a job, lost my health insurance. I have a chronic health condition. Now I can't get it treated, so I got really sick, so I couldn't go to work. And what we have seen time and time again is that as adults, single adults with chronic health condition who aren't working because of their chronic health condition got Medicaid coverage, then they got healthy and they go back to work and then they move over to private health insurance. And so there's example after example. This is particularly true for people, for instance, who have diabetes. You can't get your insulin regularly. You end up in the emergency room on a constant basis. You get stabilized. You go home. You run out of the insulin that you were discharged with, and the cycle starts again, and you're not working. Those people under Medicaid are getting health care, getting their insulin, they're going to work, and they're transitioning to private insurance. So we all want people to work, but we also have to be factual about what is actually happening in the Medicaid program. Most Medicaid recipients, adults, are working, and the Medicaid program helps sick people get healthy and get to work. Thanks.
Okay, thank you, everybody.